Let's get more on this now. I'm joined by Jay Jackson, Head of Public Affairs at Volteface, the research organisation. Thanks for joining me this morning. What is to blame for this rise, this consecutive rise in drug deaths?
Hi, Tom. Thanks for having me on. I think what's to blame, really, what underlies all this, and particularly problematic drug use, is deprivation. It's there in the figures when you look at them. If you live in one of the most deprived areas of the country, you're 18 times more likely to die of drugs than if you live in one of the richest areas of the country. The Northeast had the most drug deaths for the 9th consecutive year in a row. And that's why I've called, in my role at Volteface, for the government to really examine having drug policy as a part of the levelling up agenda, because what figures make starkly clear is that problematic drug use and drug deaths are almost always the result of poverty and deprivation. And we need to break that cycle if we want to do something serious to address the harm that drugs cause.
So what are the practical policy solutions here? We've seen that drug deaths are bad in England and Wales. They're even worse in Scotland. What should we be doing? What have other countries perhaps done to try and turn things around?
I think what we need to sort of first off do is start having a grown-up, realistic conversation about drugs and people who use them in this country. Let's ditch the stigma and start dealing in facts. Record numbers of people are using drugs, and whilst I think a lot of that drug use is preventable, ultimately, you look at countries like the Philippines, where they've got the hardest war on drugs you can imagine, where you get executed, for having possession of drugs. People still use them. So we need to get real on that. The idea of a drug-free society is a nonsense. I think, crucially, we need to start taking a health-based approach to drugs as opposed to a criminal justice approach. For people who use drugs, prison often has a revolving door. 15% of people in prison are on drugs. 10% of prisoners develop a drug addiction in prison. These places are not the places to be dealing with people who are on drugs. I think a drug deaths task force, like the one we've seen in Scotland, similar to the vaccines task force we saw in England that got results so well in that area, would be a useful thing to do. And also overhauling drug education in schools. Government guidance says that schools only need to deliver 1 hour of drug education during a child's entire secondary school period. 1 hour. And you wonder why drug use is going up amongst young people. And also that same guidance says that teachers should not direct children to the Talk to Frank website, which is a government-funded website designed to give information to young people about drugs. But it says that it shouldn't send them there. So clearly, we need to completely overhaul what we're teaching our kids in schools about drugs, beyond that just say no message, towards more sort of realistic and harm reduction measures.
A lot of change that could happen. Jay Jackson, thank you very much for joining us this morning on The Briefing.